Hello, hello.
Hello, good morning
Good
or
morning.
afternoon.
Yeah, exactly. Morning for you, afternoon for me.
Yeah.
So, all right, I will get started because we got tons of stuff to talk about. So, I appreciate everybody being on here and being patient. And I welcome you to the Art of Mindful Medicine, episode number 14, an introduction to our health and wellness practitioners and influencers. I am the host of the show, Dr. Seth Gilson. I am a biological dentist, certified yoga teacher, speaker, and personal coach. And we have a very special guest today who I'm very excited to talk to, Dr. Catherine Clinton. Dr. Catherine is a licensed naturopathic physician with a focus on gut health, autoimmunity, and psychoneuroimmunology. That's going to be fun to talk about, guys. When in medical school, Dr. Catherine was diagnosed with and healed from an autoimmune disease that affects the gastrointestinal tract, leaving her with a passion to prevent autoimmunity in children everywhere. Dr. Catherine addresses the psychoneuroimmune system and gut health of children and families through a deeper connection with the world around us. Dr. Catherine is passionate about the connections we have with the world around us and how these connections can regenerate our health and the health of the planet. She sees an urgent need for healing our internal terrain as well as healing the terrain of the world we live in. Dr. Catherine has multiple peer-reviewed medical journal publications as well as a guest writer for several publications. She is a respected author, speaker, and pediatric health advocate, and Dr. Catherine practices in Eugene, Oregon. Dr. Catherine, thank you so much for coming on with us today. Really excited to have you and talk about a lot of these very cool topics. And as always, I always start the show with gratitude, so I would love if you could share 3 things that you're grateful for with us today, please.
Absolutely. I am grateful for my family and their health. I am grateful for the sun that is shining, and I am grateful for the water that I have to drink today.
Awesome, beautiful. And I love the nature background. I mean, I'm in awe of it. I love where you live. So I love where I live too. But I mean, the area that you live in is fantastic. So can you start off by telling us a little bit about you, Dr. Catherine, where you're from, how you grew up, a little bit of your personal life when you were younger. Tell us who you are.
Absolutely. Trying to chase the sun a little bit here.
That's all right.
So, my early childhood was in the South. It was in Owensboro, Kentucky. And then I moved out here to the Pacific Northwest. I'm in Eugene, Oregon, and I am a licensed naturopathic doctor, with a focus specifically on gut health, on autoimmunity. Excuse me,
That's okay.
on gut health, autoimmunity, and psychoneuroimmunology.
Hmm.
And so that has been my passion. When I first got started in medicine, I assisted with a midwife, a local midwife in town, and she really turned me on to the power of natural medicine and sort of our place in the natural world. And um, I knew right away that I wasn't supposed to be a midwife. I like my sleep. Um, she's amazing, but that's really the springboard that got me to naturopathic medical school. And when
Hmm.
I was in medical school, I was diagnosed, second year um, was hard, very hard.
Hmm.
Medical schools kind of do, as you know, they sort of do that initiation that first and second year,
Hmm.
and it was rough. And so it was the straw that broke the camel's back, so to speak. So I was diagnosed with ulcerative colitis, which is an autoimmune condition that affects the GI tract.
Hmm.
I was diagnosed with Hashimoto thyroiditis. It was really racking up my autoimmune condition.
Yeah, right.
Yeah, I was diagnosed with Lyme disease and multiple GI infections. So that kind of started my interest in GI health. And as we are starting to see now, GI health is connected to everything.
Hmm.
So, so that interest in GI health really exponentially exploded into everything because, as we know, gut health, the gut microbiome is really ecosystem health.
Mm-hmm.
When we first started researching the gut microbiome, it was, we're fascinated with what's one strain.
Mm-hmm.
This one strain does this. This one strain does that. We now know that that's not how it works.
Mm-hmm.
It's just like our communities here um, in human society. We work together in guilds and we work together to either, or I should say, they work together, those microbes in the gut work together to either promote or kind of set our health back. And they're not doing this with some agenda,
Mm-hmm.
right? They haven't picked out people that they deem worthy of good gut health or
Mm-hmm.
not worthy. It's really a response to our internal and external environment.
Mm-hmm.
So that became really, really fascinating. And it's becoming even more fascinating to see the research come out about microbiome health
Mm-hmm.
and what's happening. Because, like I said, it started out with a few strains, and now we know it's a rich
Oh
ecosystem.
yeah, absolutely.
Absolutely.
So, just to backtrack a little bit. So, initially, I mean, this was all when you were already in medical school. What inspired you initially to even pursue medicine?
I think it was assisting with the midwife.
Okay.
I was in my previous life before a doctor, I was competitive in Taekwondo.
Oh,
And
beautiful.
yeah, that was my dream. I went to the 2000 Olympic trials and
Wow.
did not go to the Olympics.
But still, I mean, you went through the Olympic trial. I mean, that's pretty significant if you ask me.
It is, and it's also a very small sport.
Mm-hmm.
Um, So yes, it was as high as you could go without going to the Olympics, and it is also a very small sport.
Yeah, of course.
Um, so yes, that's where I really kind of learned the connection that food has and that mind-body connection.
Mm-hmm.
And that's where I actually taught um, my midwife, she turned out to be my midwife as well,
Mm-hmm.
her children in Taekwondo, and that started that relationship, assisting with her and assisting with births. And it really opened my eyes to the power of natural healing, the power of the mind.
Mm-hmm.
Um, and at the same time, I knew this is for you, and I'll go on and be a naturopathic doctor.
Yeah, no, I
And
understand.
yeah, and that's what really kind of launched that. And naturopathic medicine has been amazing. It's been amazing to be able to treat myself and my family, and of course my patients. But it was really incredible to see. I didn't know when I was assisting with the midwife, I didn't know that there were naturopathic doctors out there.
Yeah.
And and in Oregon, we're licensed, we're primary care docs. So that initiation, those first couple years was a little rough. I thought it was going to be a little bit more like the midwife style, and instead it was more, traditional medical school, anatomy, physiology, board exams,
Mm-hmm.
pass, fail, that kind of
I
stuff.
was going to say, so what exactly? I mean, for most people that probably don't know, because I mean, like you said, you didn't even know about naturopathic medicine. I imagine that most people have never even heard of it. So, what is exactly some of the main differences between naturopathic medicine and what people view as traditional or modern medicine? I guess.
Sure, sure. Well, naturopathic medicine, and it's a little tricky
Mm-hmm.
because naturopathic medicine speaks to two different types of doctors.
Mm-hmm.
One is a naturopathic doctor, and you can get that training from a lot of different places. There's online training, there's all kinds of different training for that. But that's different than a licensed naturopathic doctor.
Mm-hmm.
And that's what I am. I'm a licensed naturopathic doctor. And so what we do is I graduated school with a degree in philosophy. So I
Very
had
cool.
to go back and do all of the stuff, I started with math 95. So I had to go back, do my math and science and all my pre-med. So you do your undergrad pre-med, and usually people do it in the normal way.
Yeah.
And Yeah. And so then you do your pre-med, your undergrad, and then you go on to naturopathic medical school where you do your science boards and your naturopathic boards, and you become licensed. And so we're able to prescribe medicine, we're able to work in the hospitals, we're able to order labs and everything except surgery.
Hmm.
Um, and so it's really wonderful because we get that standard training in pharmacology and all that mainstream medicine. At the same time, we get years and years of training in nutrition and herbal medicine and lifestyle medicine. And so it's been really helpful. And it's wonderful how they marry the two.
Yeah,
Um,
that's what exactly what I was thinking.
yeah, it's really nice because they're both so needed at times, especially with autoimmune conditions
Hmm.
that I'm I'm working with. There's just a need for pharmaceuticals sometimes, there is steroids can be so amazing when we're dealing with rampant inflammation.
Of course. Yeah,
And
yeah.
yeah, so it's really nice to have both worlds at our disposal. And I've just enjoyed it. I've been in practice for this is my 11th year,
Beautiful.
and it's been a journey. It's been a real my patients teach me as much as I learned in medical
Hmm.
school. So it's been a real pleasure these
Awesome.
last
That's
yeah.
beautiful. So now that we know a little bit about naturopathic medicine, I mean that it is really medicine itself, and also learning about nature and, like you said, herbs and nutrition. I mean, and I've talked about this in previous episodes. I mean, I don't know how that's not part of like the traditional medical training, anyways. But I think this is all medicine. I don't think you can have one without all of these other aspects, in my opinion. But that's how things are right now. So we'll
I
leave
agree.
that we'll leave that to another discussion. Um, and I also understand that you have a few children. And I also understand that you do homeschooling, which is a beautiful thing I've heard, and especially with everything going on right now, I know that's a big topic for a lot of people. So how have you been able to juggle homeschooling and raising kids and having your medical practice essentially over the years?
Well, so it was a choice. I'll say that first, because I
Hmm.
know a lot of people, especially now, um, don't have a choice.
Hmm.
So there was that. It really stemmed from a desire to stay home with my children. When my son was 2 weeks old, I went back to practice. So I was seeing patients when he was 2 weeks old, and that really was unpleasant. It was traumatic in a sense for both of us. So, after a year of doing that, I cut down my practice and transitioned to a concierge practice.
Hmm.
So, I'm that little kind of country doctor that has my little black bag, and I come to see you at your house, and I often treat the whole family in a visit. Um, and it's been wonderful. My kids have been really, really open and excited about homeschooling. We have a great community here of homeschoolers so that we can do sort of a co-op
Hmm.
kind of approach to it. And it's actually allowed us all some flexibility. It's allowed me some
Hmm.
flexibility to practice in the way that I practice and also to set up our days the way that best feed us. For example, we're not the best in the mornings. We like a little snuggle time, and that really sets up all of our nervous systems for the day.
Hmm.
So I've been really, talk about grateful. I've been so grateful for being able to make that change with my family and with my kids. And I know it's not for everyone, but right now, it is the prevailing norm in our
Hmm.
society, right? To be
Yeah.
doing at least online school at home. And my biggest success, my biggest lesson in homeschooling with my children has been the power of patience and connection. So oftentimes we get bogged down in our list of to do
Mm-hmm.
things. My daughter's 6, so it's that learning to read, and all these different scholastic goal
Mm-hmm.
posts that we put up and our society puts up. um, those go by faster if your kids feel connected to you, if they feel heard, if they
Mm-hmm.
feel like their opinion is valid. So we do a lot of unstructured homeschooling.
Mm-hmm.
We do it a lot on their terms, and we have the flexibility to do that. We do the slow wake ups. We do homeschooling mostly over breakfast.
Mm-hmm.
Everybody's sitting around the table. They've got something to put in their mouth and kind of keep them anchored to the table.
Mm-hmm.
And we can finish our scholastic kind of meat of the day over breakfast.
Mm-hmm.
And the rest of it can be fun, engaging, science, art projects, things that are just more like play,
Yeah.
honestly. So, yeah, so it's just been a wonderful thing for our family.
Yeah, no, that sounds beautiful. I mean, it sounds like you just are able to flow, and it's not. Of course, it's you just have to go with the flow and not fight it. Because I think when you start resisting a lot of these things, once you've made that decision, because like you said, that yours was a choice. So once you make that choice, it's just you flow with things, and you know at the end everything will kind of get done. It's just there's a lot of different options and avenues as to which you can take to get these things done.
Absolutely, absolutely. And especially now with parents that aren't choosing to homeschool but have to,
Mm-hmm.
I would remind them that this time is going to go by fast.
Mm-hmm.
Fears of falling behind are um, objectively, when you compare them to fears of your child not feeling attached
Mm-hmm.
and feeling traumatized or stressed during this time of pandemic learning, so to
Mm-hmm.
speak, it doesn't even compare.
Yeah.
It does not compare. So making connection and play and love a priority will be so beneficial to your child's life and their health and their learning and their brain development over whatever worksheets or whatever's being assigned. Make that your priority,
Mm-hmm.
and inform your teachers. I've been talking with a lot of parents in my community that aren't homeschoolers that need to make this transition this year. And that's what I tell them. Tell your teachers, this is our priority this year.
Yeah.
We are we are focusing on attachment and de-stressing and rewiring from a trauma nervous system. And so we won't be doing all the worksheets.
Yeah, yeah. No, no, and I think that it's really important to understand that is to create balance, and I think that's something that really, unfortunately, a lot of us don't do in our lives, and it's because we are not taught that. From when we're told no, this way is the right way. We always have to do things in an orderly fashion, and I think there's a balance between like order and chaos, right? And
Right.
it can be very chaotic with the homeschooling. So there's a degree of order that's necessary, but it's not
Right.
only the order that's necessary. And these things, the emotional aspects of what you're talking about with bringing up children and our own emotional states, brings me to the question as to how you wound up healing yourself. And I'm sure you could talk about this for hours. But in just a few minutes, I'm just going to assume that this is the most significant challenge you had to overcome throughout that journey, going through medical school and everything. And we are, I mean, if it does, you don't have to have an autoimmune disease to know how significant of a problem that can be for people's lives and how much difficulty it can cause and how detrimental it can be to one's kind of existence, I guess. So what was that journey like for you in a brief way of you putting it?
Sure. In a brief nutshell, it was devastating and joyful.
Yeah.
So, I was sick in medical school, so I felt really defeated.
Mm-hmm.
I was at one of the best naturopathic medical schools in the country, if not the world. I was right down the hill from OHSU, which is one of the premier teaching hospitals in the country. I had and I was working with both, I was working with MDs, I was working with NDs and acupuncturists. I was working with everybody, and I was spiraling. It was the day after my 30th birthday,
Hmm.
and it was my 28th birthday, actually. It's
And
my
just
28th
for people
birthday.
that weren't here earlier, so you were dealing with ulcerative colitis,
Hmm.
Hashimoto's thyroiditis, and you said one more thing, right?
Lyme
Lyme
disease,
disease, yes.
Lyme disease, and multiple GI infections, but those were easier than the
Yeah,
first three. So
of on the degree and the scale of what was more difficult, that was the easier things.
yeah, exactly. And so for people that are watching that don't know, ulcerative colitis is an autoimmune condition where your body sort of attacks your colon. Same thing with thyroiditis, right?
Hmm.
Hashimoto's thyroiditis attacking your body, attacking your thyroid.
Hmm.
But ulcerative colitis can be a little more challenging because it creates a loss of blood. So your colon actually becomes ulcerated
Hmm.
and bleeds. And at that point, I had had so much loss of blood. I was so weak. I had to call the hospital's emergency cab to
Wow.
come get me. And I was in a hospital bed. The intern was on the phone with my gastroenterologist, and they were slating me for surgery to remove my colon. So I called my now husband, he was my boyfriend then, and I said, meet me outside the hospital. I'll be in the bushes. And that was sort of and really I did. I hid in the bushes. I didn't want them to take my colon. I didn't want to be 28 with a colostomy bag. Um, I was in pain. I was confused. And like I said, I was seeing the best. So why was I in this state? And it wasn't that long after that I found a doctor that really put the pieces together,
Hmm.
and a doctor that became my doctor as well as my mentor. And we really started looking at the impact of psychoneuroimmunology and the
Hmm.
impact that our thoughts have on our immune system, on our biology. And I had all the pieces in place before her, right? I had all the supplements that you were supposed to take. I was avoiding my food allergens. My diet was on point, but she really opened up the window to how our thoughts affect our biology on a real, um, fundamental, foundational way.
Hmm.
And so that was really the first layer of healing that brought me back to the health that I had before I got sick. And so that's where I stayed for years. And that was good enough, but there was still something missing. And in the last 5 years, I've kind of put some pieces back into the puzzle where if we are attending to all of those things we know about in our physical body, right? The diet, the lifestyle, the movement, the mind body, the psychoneuroimmunology piece, the mind body medicine piece. If
Hmm.
we're attending to all of those things, that should give us the health that we're looking for, but it often doesn't. And it often doesn't because we are not in the context that we need to be in for these therapies to work.
Hmm.
And what do I mean by that? I mean the natural context. I mean that we are not living in the way that we evolved as humans forever.
Hmm.
We are not eating the way that we have
That's for sure.
eaten forever. Our circadian rhythms are out of whack.
Hmm.
Our world around us, we're so focused, and I have a supplement company of my own,
Hmm.
so I know how valuable they are, but they are not the end all and be all of health. They
Hmm.
are teeny little helpers, and they can be very important, but they are not where health comes from. And what I've really been piecing together these last 5 years is that we really need to be held in nature for us, for our biology to accept all of these therapies that we're throwing at it,
Hmm.
whether it's a vitamin or an herb or whatever it is, it's so important that we are living in the context that we evolved with forever
Hmm.
as humans. And we've dramatically strayed away from that kind of lifestyle, and putting those pieces together has really, it's been life changing. It's
Yeah.
been life changing for me and my family, and definitely for my patients. So
No,
that sort of,
that's beautiful. I mean, it sounds to me like what you're saying is you can have all the pieces in place, but if you're not able to kind of put the puzzle together, so to speak,
Mhm.
I mean, it doesn't really it doesn't manifest in healing fully. Is what I'm gathering from what you're saying. It's like because you can have all the external factors. I mean, you can be. I mean, that's why people think that like being wealthy or having a lot of things is going to create happiness and health and things, but that doesn't come from without. It only comes from within, and until you can actually have that connection with yourself first,
Mhm.
then you can connect with nature, and then you can appreciate all of the things that you have around you, like the supplements, the amazing food, the beautiful
Mhm.
sun, the water, like you're grateful for today. I mean, there's a lot of things that people don't. I mean, I feel like we all innately should. I can't obviously I can't speak for everybody, but I feel like we innately know these things if we
Yeah.
allow ourselves to kind of peel away some of the layers that we have or the masks that we've put on in order to reach that space that like, oh, this is what it feels like to actually feel good, not
Hmm.
just be complacent with where I'm at or just dealing with or willing to deal with whatever circumstances you have, to actually go a little bit deeper and work on your own healing yourself in an emotional, I mean, I guess for lack of a better term, mental type of way.
Hmm.
And I think it's very profound that you were actually able. I mean, not a lot of people are able to do that. So.
Well, I'll just be honest with you. It didn't come from this calm place of exploration and scientific discovery.
Hmm.
You know,
Yeah, yeah.
it came it came from a place of fear.
Hmm.
I moved out to the country uh, of like 4 years ago, and that's when it started. I was like, uh, our reception is a little bit spotty.
Okay.
And so I I would have my husband, please keep your phone on at work. I'm out here all alone. Um, and I say it like that, but it was real. It
Uh
was a
huh.
real fear. It was an anxiety. And that first winter, we were heating our house with a wood stove, and I was looking at the fire, and it's roaring and crackling, and I start to have sort of a panic attack about the power of fire and,
Hmm.
what this is so devastating. It's so powerful. And,
Hmm.
you know, um, it was in that moment I was like, wow, I'm scared of where I live. And I
Hmm.
chose to live here in
Hmm.
nature. I'm scared of the fire that's heating our house. We went to the beach a couple months ago and I was scared of a tsunami. So you're talking about the masks. I had been fully indoctrinated in this life of fear.
Hmm.
And I had all my healthy living things. I'm out in the country, I'm doing my yoga and my qigong.
Hmm.
We're doing our heart math. Hi, Patty. And we're doing, all the things that we should be doing. And I am literally freaking out. Um, this claustrophobic panic. Ah, and it was from that where I said, okay, just take a second. What is going on with this?
Hmm.
Um, and it kind of centered around a fear of death and a fear of these connections that I hadn't been connected to. And then I realized, wow, you are so out of context. Your safety comes from a cell phone. You want, this forced air to come out of a vent and heat you,
Hmm.
just being completely removed from how a human has developed.
Hmm.
And that kind of got the gears turning of like, oh. And so then I forced myself to go camping out of range,
Hmm.
to take just the kids and I, just the three of us out far away and
Hmm.
feel that discomfort and find the comfort in the discomfort. And that's really what led me to that last piece. It wasn't this beautiful discovery of health. It was literally fear moment after fear moment after fear moment
Mm-hmm.
until I was so tired and confused of the fear that I finally faced it and said, what is the deal here?
Mm-hmm.
And it was just a complete lack of disconnection. I was completely disconnected from our world.
Mm-hmm.
And it sounded so weird for me to say because here I am. I wanted to move to the country because I prioritize being in nature. We go on hikes. We do all the stuff you're supposed to do to be connected to nature. We hug trees,
Mm-hmm.
So, there's a quintessential stuff we're doing, and that didn't connect me. It was really being able to spend that quiet time and really feel held. It's like, when is the last time we have gone to a river and plunged in that icy water and then let the rocks that have been baking in the sun just heat up our whole body? Try it, because that right there is life changing, and it
Mm-hmm.
sounds like child's play, but that's really what is
That,
life changing.
yeah.
That's
I mean, that's the
Yep.
fun of life. I mean, that's what we're. I mean, we're really kind of here for. Not necessarily to be on our phones all the time, even though, of course, like they obviously have value, like we're using them right now. But I mean, I
Absolutely.
think to be able to appreciate nature, like you're saying, is an absolutely beautiful thing. And I've just been literally the past year or two, like looking for more ways to go and do that as often as I possibly can. Um, but like you were saying, I mean, the lessons that people learn, and unfortunately, fear is an extremely driving force in our lives. And that
Mhm.
I think that's just part of our biology, really. It's part of our
Right.
natural state. I think that's how we've evolved. I mean, animals in nature, I mean, there's a lot of chaos and a lot of death essentially when around life, and for there to be life, things have to die. So I mean, and obviously animals, ourselves, and nature wants to live. So I mean, there's going to be once you have that the conscious awareness of that you are alive and you are experiencing kind of the universe as you are being, then you have this, like you said, a quintessential kind of thought process as to like, okay, I'm here, I want to stay here. So like you that and that creates a fear, which is a huge driving force to keep
hmm
us alive. So I mean,
hmm
I don't think there's anything wrong with fear. I just think the way we respond to fear is extremely important. And life, like you said, I mean, there's fear factor after fear factor, and you're going to get pushed constantly in these places until you see it, until you actually are awake enough to realize, okay, this is what's causing all of these problems. And life's going to keep pushing you and pushing you and pushing you. And like we're going to talk about soon, and I think this is what you do with a lot of your patients, is you talk about resilience. And building resilience is basically what you did without really knowing that that's what you were doing, I think, until you had your aha,
hmm
this is what I'm doing here, and this is why. So I think that is a beautiful process, and it seemed like you definitely got more in touch with yourself, and that kind of brings us into the topic of mindfulness and meditation and yoga, which you already kind of talked about a little bit or mentioned. How would you describe what mindfulness is at this point in your life?
That's a great question. Mindfulness for me, I've been talking a lot about this on my Instagram, because I've been doing a month series about how we can um, build resilience to chronic stress and trauma,
Mm-hmm.
right? So, mindfulness is a huge part of it. And mindfulness, we kind of have this idea that, like you said, fear isn't the issue.
Mm-hmm.
Fear is a natural human thing. It's meant for us to survive. It's meant for our survival. It's meant for our well-being.
Mm-hmm.
When we hold on to that fear, that's when it becomes a problem.
Yeah.
Absolutely. So mindfulness to me means, oh my, Oh my goodness, Patty, you are dropping some
Yeah,
knowledge bombs in the comments. This
right.
is
Yeah.
absolutely
So
true.
so Patty's my girlfriend. So she and I discuss these things very quite regularly. So and this is why I'm so happy to get to talk to you and get to know you more, and share this with people because I mean it's just so much in alignment. So sorry, as you were saying, but
No, she's just dropping some knowledge
yeah, yeah.
bombs
I
in the
mean,
comments.
to
It's
to be
awesome to be.
aware of fear and transmute it it really truly is a beautiful process. Um, so
It absolutely is. It absolutely is, and it's an essential human process, I think, because because just like we were saying, fear is an essential part of our survival, and it's the attachment, it's the holding on to fear that causes those biological problems, right?
hmm
So mindfulness to me means being conscious of our subconscious patterns or scripts, right? We all come into life with some kind of epigenetic stress or trauma pattern that
hmm
we've received from our parents, and hopefully we've received that calm, uh, nicely wired nervous system where we encounter stress and trauma and fear and we react and then we calm down.
hmm
And hopefully that's what we got. Most of us have come from families that haven't been safe. Most of us live in a world that's not safe, right?
hmm
So we have these stress responses that are passed down from our parents.
hmm
For me in particular, or for me, for example, uh, I came into this world with a hyper reactive stress response, right? So I am flooding my system with cortisol in response to stress. I'm very hyper reactive to it. Not so much anymore, but that's what I came into this life with. And I know which parent I got it from. I know I can see it in my grandparents, and
hmm
I know which one of my kids also has that nervous system,
hmm
right? So that's when we say that we pass down memories epigenetically.
hmm
There's been all these studies about the Holocaust survivors and epigenetic passing
hmm
of memories down. And what does that mean? It sounds so woo and mystical when it's put out like
It's
that. But
generational
really,
traumas, really. It sounds
yeah,
like.
and absolutely. And really, what it is those stress patterns.
hmm
It's how your body responds to stress. So, right now, if someone jumps out at me, my body goes over the top with cortisol so I can run away from
Yeah.
the bear. Sometimes people have come into this life with stress patterns that are detached. So, the bear comes and we just kind of fold and play dead, so to speak. There's so many different stress and trauma patterns that happen.
hmm
And being mindful to me at the very core and the power of it means being aware of some of these subconscious patterns
hmm
or soundtracks that we have going in our mind. I'm
hmm
not good enough. I'm
hmm
whatever that soundtrack is, and being mindful of it.
hmm
That doesn't mean that our mindfulness means we clamp down on those
hmm
things, and
It's actually quite the
mindfulness,
opposite. I feel
right?
like. I mean, it sounds to me like because some of the studies that I've done is in Ipsilu Tantra, and it sounds like what you're referring to is being the witness, is
Right.
just observing your own thoughts, and then it creates like there's almost like a duality within us, and you have to be the observer and also the observee at the same time, and it can be a difficult concept for people that I find, but it's extremely profound when you understand it and start practicing that.
Absolutely, absolutely. And like telling my story, that's how I came to, it was taking a step back and witnessing panic attack from fear after panic attack
hmm
from fear and questioning what in the world is going on.
Yeah.
Um, and that is so powerful. Even, when we look at it from a quantum physics perspective, observation changes events.
Yeah.
So just our being aware of those
hmm
subconscious tracks and responses, just that can change it. It's so profound.
Yeah.
Um, so that's what mindfulness means to me. And I've been really enjoying my own journey into mindfulness and my patient's journey into mindfulness. And you mentioned it just briefly before, but I think that my next big exploration and mindfulness needs to be around death
Mm-hmm.
because there's still a lot of fear around that.
Mm-hmm.
And I intellectually know that that's not necessary. I intellectually know that the hardest part for death for me is loss of people I love,
Mm-hmm.
right? Um, but but the fear around death is still there.
Of
So that's
course.
my next journey.
Yeah.
I'm excited to really delve into the death hole.
I think no, that's a cool thing because I think it is something that should be dealt with throughout life. It's not this traumatic event that we have to be so shocked about at the end of life that like we don't know that that's coming. I mean, to be prepared in whatever degree that matters to you is really important to work on throughout life. And I think doing so will lead to a healthier, happier, longer life. Honestly.
Absolutely, absolutely. And especially being a pediatrician that works with parents,
Mm-hmm.
there's so much fear around death. Um, and I get it. I mean, talking
Yeah.
about my
Obviously. Yeah.
children dying makes me a little nauseous.
Yeah.
It's
Of
not,
course.
yeah, absolutely. But making choices, making parenting choices, making lifestyle choices from a fear of death is not doing us any good. It's not doing our children any good.
Yeah.
And it's the same fear that pervades our medical system.
Yeah.
Um,
a hundred
so
percent.
we are making choices just at how effective we can be at pushing away death.
Mm-hmm.
And we've left something out in that fear, and that's life.
Yeah.
That's death comes with life, and it's scary and hard, but it's also something that we really need to incorporate. Our whole society is pushing back so hard
Mm-hmm.
against death that it's really taking away our ability to live.
Yeah, 100%. 100%. I mean, if you just focus on one side of the equation, I mean, you're going to be completely imbalanced. And like you said, in my opinion, and based on the people that I've spoken to, like yourself, I mean, traditional Western or modern Western medicine is out of balance with that aspect of things. And there, again, there's a lot of layers to that, which we won't get into. But I mean, there's actually a lot, a lot more that I'd like to talk about with you. And I just want to let everybody know that this live cuts us off in about 15 minutes. So I am going to start another live right after this so we could finish up some of the questions and do a quick Q&A for some people that I'm sure will have questions. So if you are watching, Dr. Catherine did say that she would give us a few extra minutes of her time today after this. So in about 15 minutes, I am going to end this live and restart another one. So stay tuned for that. But as we were talking about mindfulness, and you started to allude to it a little bit, but incorporating in your daily life and in the life of your practice, I mean, what are some of the ways that you do that? I know. It's okay.
Great question. So mindfulness should be something that we can apply to everything. And I really enjoy talking with my patients about mindful eating, about mindfulness of our body symptoms. Our society has gotten so good, just as good as it is about pushing death away, it pushes all those messages of our body away, all those symptoms. And that's our body telling us something. Those are really important messages.
Mm-hmm.
And uh, so so being mindful can be anything. When I was in school and when I was sick, I was doing qigong retreat after qigong retreat and doing anything I could, like, okay, I'm mindful, like, when am I gonna be better? And
I'm
it
laughing because it's so. I mean, it's just a very typical thing that I see with a lot of people in this country, to be perfectly honest. I mean, and it kind of is what it is. I mean, everybody's got their way of doing things, and I have nothing against it. But I mean, what you're talking about is basically like the American yoga community essentially.
Hmm.
And I mean, I am not saying I am a veteran of it. I am still fairly new to it. I am a yoga teacher now, but there's a lot there's a lot of like forceful pushing, like not the opposite of what yoga seems to be
Hmm.
in my eyes, and the people that have been in yoga for years and years for most of their life. I mean, that, and from what they say, it is exactly the opposite of what it seems to be put out there in the media and things like that. So I completely understand what you're saying.
Absolutely, absolutely. And I see it with parenting a lot. That's one of those things that kicks up those subconscious patterns and those subconscious trains of thought, and all of a sudden you're acting like your mom or your grandmother or
Mm-hmm.
grandfather. And so being mindful, there's an aspect of mindfulness that I think we forget, that's compassion for
Mm-hmm.
ourselves. Um, Not being too attached to something that we did or we thought or a mistake. Mindfulness is knowing that those things happen and to have compassion with ourselves.
Mm-hmm.
And I see so many parents falling into that trap of the parent guilt and, you know, feeling really responsible and holding all that weight. And mindfulness is really that flow state where you realize that we're all humans and we're all going to have faults and flaws, and we're going to have lessons that sometimes we come back to hundreds of times,
Mm-hmm.
and that's life. And mindfulness is not being attached to a result. It's not being attached to a state. It's letting things flow.
Mm-hmm. Absolutely. I I completely agree with you. um, so why is it that you believe, and based on your experiences, I mean, personal and in practice, well, first of all, what are some ways that you incorporate it in your practice? And then, why, what are some examples as to what led you to believe that mindful practices are so important for good health?
Absolutely. Well, okay. So some of my favorite things that I do with my patients, I absolutely love the Heart Math Institute.
Mm-hmm.
Um, Go Google them. They're amazing. They're cutting edge. They're on, um, I just cannot say enough good stuff about them.
No, you're the
They are,
second person that told me about them. I interviewed a functional medicine Dr. Carolyn George a couple weeks ago, and she is a very big fan of them as well. So
yep. Because there's something out there. Boy, I'm going off on a tangent, but I trust you'll pull me back.
yeah.
So, um, so I love the Heart Math Institute and using their heart coherence exercises for mindfulness. So
Hmm.
that's on track. But I'm going to take a left turn
Okay.
because the thing that I love about the Heart Math Institute and their style of mindfulness is a technique that they use called heart coherence.
Hmm.
And we've heard a lot about the vagus nerve, right? And vagal tone and what that means as far as our nervous system state, right? So our vagus nerve is the longest nerve, cranial nerve that we have,
Hmm.
and it innervates more than any other nerve in our body. And one of the most interesting innervations that it does is the heart brain connection.
Hmm.
So it connects our heart to our frontal lobe directly,
Hmm.
right? So it's not a chemical messenger or a heart rate dependent
Hmm.
or anything like that. It's a nerve being activated by the heart, zipping up to the frontal lobe, and that's heart coherence. And how do we get in heart coherence? We become mindful of our breath. We bring that attention to our heart. We stay there for a few breaths and kind of calm down and let tension out of the body.
Hmm.
And then the thing that the Heart Math Institute does that a lot of mindfulness practices don't do is that they incorporate a feeling of love. So it can be a feeling of appreciation, of joy, an accomplishment, a day of accomplishment, maybe graduation or receiving an award, whatever that is that brings you a feeling of joy,
Mm-hmm.
right? Um, I focus on those hugs that my kids give me where their arms and legs wrap all the way around me. Sometimes I focus on that feeling I get when I'm laying in the warm sand with the sun on my face. Whatever it is that brings you that joy, just keeping that feeling with that slow breath into the heart, 5, 6 breaths can completely change your physiology.
Mm-hmm.
And we can go through the list, but that's really boring. So I'll just say it completely changes your physiology. You go from inflamed to anti-inflamed. Your nervous system is rewired,
Mm-hmm.
and this is what is called or is known as heart coherence.
Mm-hmm.
So I use heart coherence exercises with myself, my patients, my family, and it is hands down the most beautiful mindfulness technique that I've come across, because it's so far into that heart centered healing, yet it also utilizes technology. So when I suggest it for an 11-year-old or a 12-year-old, they're happy to do it because they can do it at the same time as, HeartMath has these neat video game-esque
Mm-hmm.
tutorials for people. And so it's a really neat software that really brings us back to our heart and
Mm-hmm.
that feeling of heart coherence. So that is hands down my favorite mindfulness technique.
That sounds
Um,
very profound. I mean, I think it. I do not know much about the app because I just haven't had my own time to really look into it. But now that you brought it up again, I mean, you're the second person that's spoken so highly of it, that I respect. So I'm definitely going to check this out. And it seems like, especially for kids, that is a fantastic way to introduce mindfulness and just a sense of calm because kids are, I mean, just the youth and my generation included, we were kind of obsessed with the technology. And if they
mhm,
can utilize the technology to bridge the connection between themselves and that mindfulness using something that they enjoy, I mean, you can be as traditional as you want, but I mean, trying to get a modern American kid to practice any kind of mindfulness, like good luck to
yeah,
you without using something that they're actually interested in. So I think,
absolutely.
yeah. So Liberty said that they love the HeartMath Institute. So I think that's fantastic, and I'm definitely going to look into it and recommend it for some people. So thank you for sharing
Yeah,
that.
absolutely. I absolutely love it. And one of the things I love about it is it brings an awareness of the power of these emotions. And and especially with our children, that's so important.
Mm-hmm.
A lot of our children are growing up um, where a majority of their social interaction is online.
Mm-hmm.
So
Especially
they are,
now.
especially now,
Yeah.
and online communication, it
It's not
takes
the
away.
easiest thing.
Yeah,
It is very misconstrued in many, many ways.
mhm.
I completely understand what you mean. But sorry, I don't mean to keep interrupting.
No,
Go ahead.
no, no, not at all. That's exactly what I'm saying. It can be hard to foster those feelings of love and gratitude and those positive um, feelings over social media,
Mm-hmm.
right? Or over a Zoom call.
Mm-hmm.
So I love that the heart math software and exercises, and you can even just Google a heart coherence um, exercise on YouTube. You don't need the software. The software is great, and especially as a practitioner to be able to offer that to patients, but even just becoming familiar with the heart coherence breathing techniques is so important for our kids and
Mm-hmm.
ourselves to remember, wow, a thought I have can change my cells.
Yeah, the physiology, absolutely, absolutely.
Absolutely.
I talk to patients about this all the time. I mean, because obviously being a dentist, I mean, I deal with people's fear and traumas and things of all different sorts all the time. And being a yoga teacher now, I tell people to focus on their breath, close your
Mhm.
eyes. I always have some kind of soothing music on, so and I tell people to focus on their breath because our breath is directly connected to our neurological system, and that can affects our heart rate. And like you said, the heart is intricately connected to our brain. I mean, and
Absolutely.
all of these things, and like you said, in just a few breaths, can profoundly change our state of mind, our physiology, and our emotions. I mean, it has so many fantastic effects. And we are going to get cut off here in just a minute or two. So, and I actually have a good segue right into the heart brain coherence that we were just talking about. So, like I said to everybody before, I'm going to end this live, upload it, and then immediately start another one. All right, we're back. So, thank you for spending more time with us. I know there's going to be a few more people joining, but we were just talking about heart coherence, and I know this is something that you talk about quite often. So, if you could talk to us about the effects of chronic stress and trauma versus positive emotions on heart-brain coherence a little bit, I think that's very important for people to understand.
Absolutely. Um, so what happens with stress and, chronic stress and trauma is we really have a rewiring of the nervous system. And we talked about that a little bit in the last live we did,
Mm-hmm.
but it's actually just a severing. So that connection that goes directly from the heart to the frontal lobe is rerouted,
Mm-hmm.
and it just doesn't exist anymore.
Mm-hmm.
It's rerouted so that we can run away from a stressor, so that we can be in that fight or flight zone.
Mm-hmm.
But often we don't live in that world anymore. We don't live in a world where our only predators are big animals, right? We feel that lack of safety driving to work. We feel that lack of safety trying to discuss something on social media.
Mm-hmm.
Our current climate, just in general in the world, doesn't exude safety. And so that lack of safety puts us into that fight or flight zone. And that severs that heart brain connection, that
Mm-hmm.
heart brain neurological connection. And we see something similar happening in the gut microbiome. So when we have, I know you didn't ask this, but
No,
I'm
that's
just going
okay.
to include it, um, because they're all connected.
Yeah.
So when we have that chronic stress or trauma, we see a shift from a more beneficial microbiome to a more harmful microbiome. And it's just because they are responding to the environment we're giving them, right?
Mm-hmm.
So when we live in an environment of chronic stress and trauma, it doesn't help our health, and it certainly doesn't help our gut microbiome. So when we see that shift to less beneficial composition of microbes in the
Mm-hmm.
gut microbiome, we see a decrease in our Treg cells. And our T regulatory cells in our immune system are the cells that go in and put the brakes on inflammation. In the last few months, we've probably heard a lot about cytokine storms
Mm-hmm.
and immune systems not being able to stop. And that is what the Treg cells do. They come in, they say, okay, the infection's gone. You guys
Chill
can go
out.
on vacation now, chill out. Yeah. Um, chill out, exactly. And the same thing happens in the gut microbiome. So those T regulatory cells are made in the gut microbiome, and when we see someone affected by chronic stress or trauma, we see a decrease in those T regulatory cells.
Mm-hmm.
So we see that chronic stress and trauma sets us up. It rewires our heart brain neurology. It shifts our gut microbiome. It shifts our immune system, making us more inflamed, making us less able to fight infections and communicate cellularly.
Mm-hmm.
Cellularly, and you know, it really does change our physiology. And like I alluded to earlier, it's because we're not supposed to live in that state of um, feeling not safe.
Mm-hmm.
And And so that is what chronic stress and trauma does. And it's a ripple effect that goes throughout our body, affecting our that heart-brain neurology, our brain development and function, our immune system, our gut microbiome. Uh, it just goes down the list
Mm-hmm.
of our body systems. And it really, when we stay in that pattern of chronic stress or trauma, it really shifts our biology into one that lasts a lifetime. When you look at the studies about early childhood adversity, that can set us up for a biology of inflammation that leads to autoimmune diseases, cardiovascular conditions, anxiety, depression, mental health issues, neurological development,
And
chronic disease.
yeah,
Yeah.
I mean, no, no, sorry. I mean, this is exactly the quote unquote problem that a lot of people have with this, because you can't definitively diagnose the root cause of some disorder. Because,
Right.
like we were talking about earlier, epigenetics, I mean, we're all different. I mean, our
Mhm.
genetic makeups are just different. And when you have a, I mean, just a barrage of external environmental effects on one organism that is different than every other living organism, I mean, you cannot expect it all to be the same. You can make generalizations, which is where I think, yes, when you're dealing with huge numbers of people and societies and things, you have to make certain kinds of generalizations. But that doesn't mean that you ignore the fact that we are all individuals and our health is an individual. I mean, kind of. I mean, it's just individualistic. I mean, you cannot make a gross. What I don't. I'm trying to think about the right way to put this. You can't just make a
Yeah.
blanket statement that applies to everybody,
Mhm.
and I think that's where a lot of our our faults are lying in our current medical system.
Mhm.
But you were talking about stress and trauma and how it affects the microbiome in our cells. So in the most simplistic way that you can, because I mean, it's easy for people to hear this and say, okay, that makes sense, but how does it work? I mean, how do we know that's something that happens? Because I mean, I mean, just playing devil's advocate, because I obviously have the same beliefs and feelings and experiences about this that you do, and have seen them in patients. But what is your simplest explanation as to how stress and trauma directly affect our microbiome, the gut bugs, and our own cells, and creating these chronic disorders or other ailments?
Absolutely. Well, the simplest
I
way
know
is to
it's.
say that the mind and body are connected.
Mm-hmm.
There's no, we put up so many false dividers.
Mm-hmm.
There's no division between our mind and body.
Mm-hmm.
And to put it simply, and to kind of take us even, yards out from where we're talking now, there's no division between where my skin ends and the world starts. So it's really time that we bring that into our medicine. It's time that we acknowledge that it goes much further than our reductionistic science has led us to believe. And that's not an indictment of our reductionistic science. Being able to look under a microscope and
Mm-hmm.
identify things, that's powerful. That's information, that's
Yeah.
knowledge. But if we don't plug it back into the bigger context of our world, we are literally missing the bigger picture.
Mm-hmm.
And we live in the bigger picture, so we should be looking at it occasionally.
Mm-hmm.
Um, and right now, if we look at the big picture, we see that we are in a state of steady decline. Our infertility rates are the highest in human history. Our extinction rates, we have 1 million different species set to go extinct in the next 2 decades.
Mm-hmm.
I'm just going to say that again. Over 1 million species of life on our planet are set to go extinct in the next couple of decades. And I believe this is a direct result of us not extending our medicine
Mm-hmm.
and not extending, when we look at the effects of stress and trauma and everything, a
Mm-hmm.
diet, lifestyle, on our gut microbiome and on our heart brain neurology and on our immune system. what becomes crystal clear is that it is all connected. It is a big spider web, and if we pull on one string, all of the strings vibrate.
Mm-hmm.
And
That's a
it's
great
no
analogy.
longer, yeah, and it's no longer Wooville or Hippie Town, you know? There is science to confirm what we have intuitively known forever, and it's
Mm-hmm.
so exciting to be a part of that right now.
Yeah.
But the science is really confirming everything that we have been talking about today, that our mind and our body has as much influence over our biology and our health as our external world and what we put into our body
Mm-hmm.
and all that.
Yeah.
So it's really powerful.
No, absolutely. And it's interesting that you bring up um, how a million species are supposed to go extinct in the next couple of decades. I mean, and I think it's important for people to realize it's not, we're not only destroying the planet. I mean, don't get me wrong. I agree with you, and I think there's a lot of changes that do need to be made. But from where we've come in our history as human beings, and the way we've devastated the planet has absolutely improved now. However, like you said, like being able to look under a microscope, being able to compartmentalize things is extremely important, and helps us gain more knowledge on things that we innately understand. But it allows us to communicate these things in a way that we can all kind of agree on and understand things, because it's important to know that we aren't just destroying things, like I said, but we have done a lot. We've made a lot of beautiful advancements, and I think that the technologies and the knowledge that we have, we need to continue to build on and not forget about these things that we already know. And like you said, there is no division between us. I mean, it's like we like to separate our body into organ systems and things like that, but what we forget at the end of the day is that we are one organism. And studying biology for a good portion of my life is we cannot forget that everything we do, and that's why I love the analogy you said, like when a spider, there's one tug over here, the entire web moves. So that's really, really important for people to understand, that just because, for example, I'll use my industry, just because you have inflammation in your gums and your mouth does not mean that there isn't something going on in another part of your body, specifically your gastrointestinal tract. And I talk to my patients every single day about how inflammation here affects inflammation down there, and inflammation down there affects inflammation up here. So this is extremely important for people to understand. Medical professionals and regular, I mean, average people that have not studied medicine. So I think it's extremely important. And what you're talking about, it's leading me into another question about how nature is very healing for us, and grounding is very healing for us. So what are, and again, because I don't want to take up too much of your day, so I do want to get through these questions. And again, people, if you're watching and you have questions, please ask questions, so we can get some of these things answered for you. But what are some of the ways that you incorporate nature to heal people? How is nature healing to us?
That's a big question.
Yeah, I know.
But let's see. You know, nature should really be thought of as our foundational step for health. You know, we're getting to a point where we're acknowledging that diet and lifestyle have a huge impact on our health, and they do. But our connection with nature has a foundational, important role in our health. So we spend a lot of time talking about the gut microbiome and immune system and our heart brain neurology, and we didn't talk about our mitochondria. And our mitochondria, it's so exciting. The research that has come out in the last 5 years really confirms that we are powered by nature.
I mean,
sun powers our
most
cells.
people don't know
Water.
where mitochondria actually came from in ourselves, and I mean, you can briefly describe that if you want. I know that's a huge topic, but it's also very cool for people to understand. So sorry, go ahead.
It is. Those are viral components. They were picked up by us. The mitochondria, when we look at their function, it is amazing. The mitochondria are, so just a brief little background, mitochondria are the powerhouses of our
Mm-hmm.
cells, right? And their currency, so to speak, is ATP. And that's what drives our cells. And mitochondrial health is tied to health of everything. So if we're talking anxiety, mitochondrial health plays a role. If we're talking about prenatal health, anxiety plays a role. If we're talking
Mm-hmm.
about thyroid health, I mean, anxiety plays a role. What am I talking about? Mitochondrial health plays
Yeah.
a role, right? So whatever the condition is, mitochondrial health plays an enormous role because our cells are our building blocks, right?
Mm-hmm.
If we're talking about the liver, it is a bunch of liver cells, and what is powering those cells is the mitochondria.
Mm-hmm.
And when we look deeper into the science, it's crystal clear that the sun can power our cells just like food does.
Mm-hmm.
Um, the amount of water that and quality of water in our cells dictates the amount of energy we can pull from our external world. You know, it's really phenomenal when we look at forest bathing and the research behind that. A few days in the forest can balance our blood chemistry,
Mm-hmm.
something that no drug has been able to do. And, you know,
And probably
the
won't, in
last,
my opinion. But go ahead.
right, right, right. Right. It's holds a primary player in our health, and we've just walked away from it
Mm-hmm.
in the last, especially in the last 100 years, especially in the last 20 years. You know, this thing I'm holding here, talking to you
Yeah.
on, is really new in our society,
Yeah.
and it's changed a lot of our ways, and as much impact as all these things have on our health and and you know the negative impact that these things have on our health, we can see that the answer or the cure, the support, the therapy for that lies in nature.
Mm-hmm. Absolutely.
And absolutely. And that's such an empowering thing for us as practitioners to learn about, for patients to understand and learn about, because we have so much agency over our health.
Mm-hmm.
And a lot of that agency has been taken away. You know, I'm getting ready to submit a book proposal and finish up a book, and
Awesome.
part of it really looks at how our self-agency has been sort of chipped away in the over the last 100 years, and especially over the last 30 years
Mm-hmm.
when we look at mainstream medicine. But it's really interesting to look at the history and the pieces, because it didn't happen overnight.
Of course.
And this wasn't the way medicine was practiced. You know, 100 years ago, 150 years ago, we had your country doctors, and those doctors were people we trusted and we knew, and we had relationships, and that power of placebo and that heart coherence and that co-regulation was so strong in those doctors. And now our doctor visits are limited to 5 minutes or less, and that
Completely
healing,
disconnected from each other. Oh my God.
yeah, absolutely. So you know, you talked when I went into my spiel about how what a crisis we are in, both our health. You know, more children are chronically sick than are healthy
Mm-hmm.
in the U.S. And we can clearly see that in our environment. And you said that we've come a long way
Mm-hmm.
in the way that with our destruction of nature,
Mm-hmm.
and learning to work and live with nature. And I agree, but I don't know if we keep on that path, if we are set for success,
Mm-hmm.
right? I think that we are at the perfect point, that we have gained so much knowledge from this journey of dominating nature and reductionistic science. We have so much knowledge,
Mm-hmm.
that if we take that knowledge now and plug it back into the context of the greater world, we are at the perfect point to pivot our medicine, our communities, our societies, so that we take into consideration not only the connection we have with ourselves and our and our agency to heal ourselves,
Mm-hmm.
and mindfulness and that connection, but our ability to heal our communities, our ability to heal the earth.
Yeah.
We're there. We have the power. We have everything we need. We just all need to stand up together and do it.
I totally agree. I mean, we absolutely have so much technology these days. I mean, we have a plethora of things at our disposal to as you said, plug back in to nature and to see the real benefits. And we just have to we really just have to really be more connected with ourselves and our hearts to want to do so, and not so much with the external. But as we're talking about how nature can heal us, I mean, so something that I've come to understanding in Ayurveda is that, and I want your opinion on this, is being that we're in different regions. For example, I mean, you're in Oregon, I'm in South Florida. Would treatments for certain disorders depend on what region you're in, based on your environment and things like that?
That's a great question. And yes, I would say yes. I talk with my patients here in the Pacific Northwest about how to capitalize on the benefits of the sun
Mm-hmm.
when we are not in Southern Florida, right?
Mm-hmm.
A lot of times when we look up our UV index here, for most of the year, it's 1, 2, or below, you know?
Yeah.
Um, but that's only measuring the direct rays from the sun.
Mm-hmm.
It's not taking into consideration that a lot of our world, water, plants, grass, reflect UV
Mm-hmm.
light. So the UV index goes up if you can get out in nature. So there's absolutely different strategies to take if you're in different geographical locations, and I think that's really warranted because if we acknowledge the power that nature has and that the earth has on our health, we also have to acknowledge that it's a big earth and there are different advantages to different places on
Mm-hmm.
the earth, and absolutely. So yeah, it does, and it does correlate. I will often make recommendations based on where a person is living as far as environmental toxins. There's so much
That's
out
very
there.
true. Yeah.
Yeah, mold, whether you live in a place that um, really fosters mold growth, whether there's a lot of environmental toxicities in your city, air pollution. There was a study I read last week. Air pollution directly affects your gut microbiome.
Yeah.
So I would say that we should be looking at our patients um, everything individual, right? Their unique environment,
Mm-hmm.
their geographical location, their work environment, their home environment, all of that. Because we have learned so much. And when we plug it back into the context of someone's greater environment, there's so many clues that we get to how to support that person's health.
Yeah, absolutely. I mean, that great answer, and I'm so happy you said that because it makes total sense to me. So again, everybody watching, please send your questions in for us, because I do want this to be more interactive for you guys as well. So if you have questions, please write them down. And I have some that people have sent me that I will get to. So, Dr. Catherine, what are some of the most chronic ailments that you actually encounter today with people?
I would say that gut health issues are hands down
Mm-hmm.
what I see most often. And it makes sense because our gut health is reflective of our ecosystem.
Mm-hmm.
So if we have chronic stress and trauma, our gut is affected. If we have environmental contaminants, our gut is affected. If we
Mm-hmm.
have latent infections, our gut is infected. If I mean our health is affected.
Mm-hmm.
So absolutely.
Okay. So gut health, and we've talked a little bit about that. So, and we also talked about resilience before and chronic stress and trauma. So, what are some of the ways that you begin teaching people how to start building that resilience?
Hmm. Well, the first thing I like to tell people is that we were born to be resilient. There's this idea of health, there's this idea of trauma, chronic stress, like it's a destination. We'll get there and the traumas and the stresses won't bother us. We'll get to a spot of health and we'll be healthy forever. And
Mm-hmm.
that's not how life is, right? We see health go up and down. It's a spectrum. And so, when we're looking at this, we need to really look at the full spectrum.
Mm-hmm.
And
Absolutely.
so, yeah, absolutely.
So, and then we got a question. So, what are the most common environmental issues you see of the states both of you live in? So, I'll let you start in Oregon. Some of the biggest environmental issues that you have there.
Uh, Absolutely. Well, you know, we have a lot of agricultural runoff
Mm-hmm.
and toxins in our water, and that's affecting our ecology from our plants and our animals and ourselves. We know that that is not good for our gut microbiome, and we know that goes across our whole biology.
Mm-hmm.
So I think that it's been a strange couple of years because the Pacific Northwest is known for its clean water.
Mm-hmm.
It's known for its abundance of water,
Mm-hmm.
and we have been dealing with droughts here.
Wow.
So I think one of the biggest issues here in the Pacific Northwest is looking at our abundant resources of clean water diminishing at alarming rates.
Yeah.
I live 3, maybe 4 miles from some wetlands, some of the biggest wetlands in our area. And our wetlands, the earth wetlands, are our water's filtration systems. And like I said, we live 3 or 4 miles from that, and we're in the third year of chronic drought.
Wow.
Our well is running dry.
Mm-hmm.
So we here in the Pacific Northwest are dealing with environmental issues that we've never dealt with before
Mm-hmm.
because of climate change. So I'd love to hear what you guys are dealing with in Florida, but I think a lot of us across the globe are dealing with similar
Yeah.
issues of environmental toxins, which that's a glossed over term, and we should be calling it industrial chemicals.
Yeah.
So we've got issues from industrial chemical pollution, environmental climate change, which is heating up our oceans.
Mm-hmm.
It's affecting our ability to soak up that increase in temperature. So we are experiencing a lot of drought here.
Yeah.
But I'd love to hear what's happening in Florida.
I mean, in my opinion, and this is based off of course, my own experiences and people I've spoken to. And I mean, I've lived down here my whole life, but the first two things that came to mind were water contamination and air quality. And
Yeah.
South Florida is essentially, I mean, Florida is essentially a swamp. So, for example, air quality, I mean, and we were talking about areas that are more likely to get mold and things like that. I mean, that's South Florida for you. It's just wet wherever you go pretty much all year long. So, like having control over your air quality is very, very important, very, very difficult right now because it's always wet. and so
Yeah.
I think avoiding mold is a huge issue down here, and with lack of construction and or lack of proper construction and keeping up with maintenance of certain things. I mean, there's been in the past few years, there's been several times in downtown Fort Lauderdale, there's been a water line that burst and broke, and then people don't have clean water. And I mean, how does that just get fixed? I mean, they obviously put chemicals in the water to start cleaning these things. But I mean, once you have to really go in, and I mean, these things are generations old, the old pipes and things that they have underground here. And I mean, so water contamination is definitely a big thing. I mean, because of like what I was just saying, I mean, the boating industry, there's tons of yachts and boats and cruise liners and things that are just dumping oil into the water. There's pollution from the beaches, pollution from just people going out into the Everglades. I mean, there's just using pesticides and things that run off from people's yards, and just a plethora of things going on. So those are two of the biggest issues that I found. Oh, all right. So Dr. Catherine got knocked out. Sorry, guys. Her phone might be dying or something like that. But I guess this is probably, well, unfortunately, this seems like a good time to end, because we are getting on just over an hour and a half here. And like I said, I do want to be respectful of Dr. Catherine's time, and I will absolutely have her back on here at some point, because there's just, I mean, it's just a huge topic. And I mean, to do this in an hour or an hour and a half is just, I mean, it doesn't really fully do it justice. But I appreciate you guys all for being on here and taking your time on this Saturday to watch. If you're not watching this live, go back to the beginning and really, I suggest going back to the beginning and listen to what we were talking about earlier on, about nature and the connection that we have with ourselves and with each other, and how that healing process is so innately important to our state of being. So again, if you want to connect with Dr. Catherine on Instagram, her name is @Dr.CatherineClinton, and that's with a C, and both with a C, Catherine Clinton. So @Dr.CatherineClinton. And I appreciate you guys, like I said, for watching this episode. If you have any comments, feedback, and suggestions, they're always welcome. You can check out all previous episodes on YouTube, The Art of Mindful Medicine, and a lot of or most of the show episodes are also on Instagram. You can check out my website at www.mindful.doctor. And again, the shows are live on Instagram Saturdays at 12 Eastern. So again, if you missed this one, or you missed part of this one or any other one, go back and check them out. I really appreciate it, all the support, and please feel free to reach out to me, ask me any questions that you may have. And as always, I will end with a quote, and this is actually a quote from Dr. Catherine Clinton, who I will talk to her about later, because I really love this quote. And it says, "Stand up strong, you are the universe. Every atom of oxygen you breathe, of iron in your blood, of calcium in your bones, and of carbon in your muscles came from exploding stars." So to me, that is extremely profound, and I could not agree with it more. We are all made of the same star stuff, so to speak. And I appreciate you guys all being on here. I hope you have a beautiful Saturday. And if you are not watching this live, have a beautiful, whatever day it is of the week that you are having or are on. And always remember, stay awesome, stay mindful. Have a beautiful rest of your day, guys. And thank you once again. See you soon.